Ari, it's my pleasure and privilege to have you today. How are you doing, guys?
Great.
Great. So what's on the topic today? What's on the menu?
Let's talk about high blood pressure, very typical disease in America, very typical complaint. Not just among seniors, but among young people as well.
Unfortunately, you're right, and high blood pressure is quite common in my medical practice. That's why I probably suggested that this topic. So, what are you interested in? What in particular you're interested in? What do you want to know?
Listen, I'm not a doctor, as you can probably
No, you're
notice.
not. I'm a doctor.
Yes.
Don't steal my title from me.
From what I know, like the typical prescription, I don't know. If someone is having high blood pressure and coming to the doctor, usually people are looking for prescription, like Metropolol, like Atacant, like some other medication, pills that could bring blood pressure down. But from what I understand, it's not the only solution, and I know you usually recommend less medication, less pills, more natural way of solving problems. Maybe you can share your knowledge and experience.
No, first of all, let me just give you some corrections. First of all, nobody comes to me and asks pills for blood pressure. Usually people tend to ignore it. And the problem is because it's hard to realize that a patient has a high blood pressure. Because there are no symptoms.
No, why? I disagree. Person usually feels fatigue. Sometimes person feels headache. I think it's person feels high blood pressure.
When somebody has the symptoms you just described, it's kind of late. Usually blood pressure goes up without any warning symptoms, and the patient blood pressure goes up from 120/80 to 140/85. And believe me, if somebody has blood pressure 140/90 over 85, he won't feel it at all.
Wow.
Nobody feels it 160/90. Usually they start feeling it higher.
But if any regular person visiting doctor just for a checkup, what is a checkup? They're checking their blood pressure, taking blood for lab, and cardiogram, etc., etc. Like regular checkup even can notice something unusual.
Yes, but there is a very big caveat in it. And because what happens is that supposedly a patient comes to my office and I check blood pressure and find out that the patient has blood pressure 160/90.
Okay.
And I said, hey, you have a high blood pressure, and you know what usually patient says?
I feel
He said,
okay.
doctor, don't worry, because I always have high blood pressure in the medical office. And it's just because white coat hypertension. As soon as I come home, I have blood pressure 120/80.
Uh-huh.
And there is a problem here. First of all, how do I know that this patient has blood pressure 120/80? He might be just having an uncalibrated blood pressure machine. That's all. We are not, or supposedly somebody has, this electronic blood pressure checker. This is usually, it's totally nonsense because it depends on the position. And it's usually, you need to be skilled in checking blood pressure. So if a patient tells that right now it's 160/90 and at home 120/80, it doesn't really mean anything.
So what do you say in this case? If person says don't worry, everything is fine, just because I'm in medical office.
No, I tell you, look how to explain you. A machine gun is machine gun anywhere. Machine gun is dangerous in the street, at home, in the space, anywhere. That's the same thing is here.
Okay, patient listens to you. I advise every patient to listen to you, but listens to you. Say, okay, it's a problem. What should we do about it?
It depends.
Prescribe me some medicine.
It depends. No, that's not that simple. That's not that simple because basically most of the time patients have so-called essential hypertension, means that usually they cannot figure out what the reason is. And in my understanding, that essential high blood pressure can be divided in three big broad categories. First, category high blood pressure is weight dependent. Basically what it means that as soon as a patient loses weight, everything goes back to normal. Why is that? It's very simple to understand. It's because fat tissue has a very big vascular resistance. So the more patient has fat tissue, the more resistance there is, the higher blood pressure is. It's like, you have a tap, and the tap water is coming out. So if you put your finger and put more resistance, the water pressure goes up, as you can feel it. The same thing is here. That's one thing. The other thing is salt. Salt, and the reason for this is this. Because normally inside the cell there is a potassium. It's not sodium. But potassium and sodium, they are positively charged, the same thing, is one charge each have. So there can be, they can exchange very easily. So if you eat salt, what happens is that you have too much sodium coming in, and the cell starts exchanging it for potassium. So potassium goes out of the cell, sodium goes in. And what happens with the cell? It starts swelling, because sodium attracts water. And as soon as everything swells, what do you think happens to blood pressure? Goes up. Third is toxic metals, like mercury and lead. Why is that? Because mercury blocks the enzyme, it's called catecholamine O methyltransferase, which blocks the degradation of adrenaline. And what happens is that
you're using very complicated terms now.
No, you know what adrenaline is, right?
Adrenaline, yes. The previous one.
What happens is that our body starts piling up adrenaline. Nothing can be done. If adrenaline goes up, what happens to blood pressure? Goes up.
Okay.
So that's three main things.
So, meaning adrenaline, if you're like connecting adrenaline with blood pressure, it means when person has a huge stress, it also leads to high blood pressure, correct?
Of course.
Okay.
Well, of course. It's a very simple thing. Supposedly you go for a jog. What do you think happens to your blood pressure? Goes up. And it's normal, because as soon as somebody has a little bit of stress and has more adrenaline, jogging or into some kind of exercise, blood pressure goes up. And everybody knows it who did the stress test, we know that. That's what it is.
So, by the way, we need a red square over there. Is it okay? Red should be red or green?
No, I don't remember.
Okay, right now it's red, so let's continue.
Okay.
It's red color.
Yeah.
Okay, so what do you prescribe to patient again? I know that you're a staunch opponent of just pills. I know that you're like always advising your patients on the side of like healthy lifestyle. But still, if you notice a person has a problem with blood pressure, what is your advice? How do you treat
The patient has or does not?
Already you diagnosed it's a problem, high blood
It
pressure.
depends on the patient. So if a patient is willing to cooperate, then my usual solution is very simple. Just check for heavy metals, bring down your weight, and no salt. That's
No salt at all?
No salt, and just go for potassium-rich diet, provided that the kidney function is good. That's one caveat. If somebody has altered or just have problem with the kidney function, they cannot take potassium and magnesium, because a few pills of magnesium can cause, I don't want to talk about that, but that can cause a lot of stuff. So potassium, nobody can take potassium or magnesium or any electrolytes without checking the liver kidney function, because kidney function can go down without any symptoms. So
how can you check kidney function?
Well, it's very easy.
Blood test?
It's a blood test. So basically what I do, I just check the blood test, of course check the kidney function, because kidney function is crucial in this. Because sometimes what happens is that there is a renal artery stenosis when the artery that goes to kidneys, they are clogged. So that can bring blood pressure up. So we are checking this, and everything is good so force, and patient wants to cooperate, then just get rid of weight, and we talked about that. Get rid of salt, eat potassium-rich foods, and that's pretty much it.
So basically what you're talking about, it is a strict diet, I would say. Because if person losing weight, no salt, potassium-rich food. It's all diet.
I don't think
It's
I don't
not
think that.
anything like.
I respectfully disagree with the term strict diet. Why is it strict?
Because it's natural for a person to. The person wants some little bit salt here, little bit pepper there, little bit sugar here.
No, I never
It's
said
natural.
I've never said anything about pepper. I never just first of all, let's just make sure that
You didn't say less salt. You said no
no
salt.
salt. Yeah, because it should not be there. And let's to make sure that we're on the same page. What salt are you talking about?
Salted in every restaurant, in every cafe.
So basically, you are hold on.
regular salt.
So you're talking about table salt, right?
Correct.
Well,
Yodai salt, how they call it.
yeah, but it has nothing to do with
Little
with the salt our ancestors ate, because it has nothing to do with the salt that is from the sea, right?
But how can you get salt from the sea?
Florida salt is very well known. If somebody can't live without salt, sometimes the Florida salt.
Sea salt is like
Yes, sea
that?
salt.
So you recommend to switch from regular.
No, I didn't say that. I said that if there is any reason to get salt in, some person,
Addicted.
you can't, addicted, no, I mean, from medical reasons,
Okay.
because some people are salt losing. So it's not going to be table salt, it's going to be sea salt.
Sea salt.
Why is that? Because the sea salt is not degraded, there's plenty of water in it, and the content is different.
And then it's easily available in pharmacies or in
No,
stores?
no.
I'm not sure about
No,
it.
it's not that cheap. It is
More
on the expensive side, but it's much better and it's totally different texture. You've never seen sea salt?
I did.
Yeah, sea salt. It's called fleur de sel. If it's from basically the best is from France.
Personally, I don't like salt at all, but like in terms of you saying no salt at all,
Right.
I am probably like little bit salt, but not salt at all. I do not like salt
Because
soup or anything like this.
If food
Salt is
is prepared correctly, you don't need it, believe me. Because salt, why they put a lot of salt? Because it's enhancer of the flavors, enhancer of
Correct.
the taste.
Correct.
So basically, which food needs salt? The food that nature lacks of good taste.
Okay,
So the food is tasty, it doesn't need an enhancer.
that's also
It's like if a woman is beautiful, she doesn't need any makeup.
makeup. But
It's,
you know, sometimes
yeah.
doesn't
No, sometimes we can put fleur de sel, yes, but it doesn't need table salt. The same thing is, who is really nice,
sea salt.
doesn't need to use those things. All right?
So you mentioned losing weight. You mentioned high sodium diet. I would say
Low sodium,
low sodium,
high potassium.
high potassium, low sodium.
High potassium, yes. High potassium.
For example, what does it mean high potassium? For example, like vegetables, what is it high potassium? Cabbage, what is it? High potassium.
High potassium is basically, if you forget the list, you can figure it out very easily. Potassium-rich diets, foods are the foods you want to put some salt on it,
Like I don't get it.
like tomatoes,
Tomatoes, potatoes,
cucumbers.
cucumbers.
You know. By the way, there's a lot of potassium in milk.
Oh,
In milk. I am against milk, but
I know,
if somebody
I know.
needs potassium, that's a very good idea to get milk on board. And as far as I remember, 1 cup of milk contains about 100 milligrams of sodium and 350 milligrams of potassium. Look, the more natural you go, the more potassium you will get. The more you are steering out of nature, or Mother Nature, the less sodium you get, the less potassium.
it all will affect coming back to high blood pressure. It all will. It will treat your high blood pressure without any medication. That's what you're saying.
Instead of telling you, say anything, let me give you a story. Okay?
What about
Guy-
all? I'm sorry. What about all of these famous medications like Metropolol, Atacant, and Swan and Son? Like so many popular pills. Just a pill and your blood pressure going down. You are totally against it.
I'm not against that. Some people just cannot tolerate down, or they're not willing to. Because some people just might say, you know, I'd better take a pill and eat salty food I'm used to, that's it. It's everybody's choice.
Oh, okay.
You know, why America is the best country in the world? Because everybody has
Country
a
of
choice.
choice.
Yes, because it's a freedom here. That's why we are here, because of the freedom. And they have freedom too. Either eat potassium-rich foods and no carbs, or they can take sodium-rich foods and carbohydrates-rich food and take a pill. It's their choice.
But I know where you're going, but it can lead to disastrous consequences. By the end of the day, if person eats high sodium, low potassium, and salt and everything, and pills, that's a recipe for disaster from what I hear.
Well, that's what I think. And the recent scandal was ibuprofen, valsartan, etc. All the sartans. You have heard about that, right? When they voluntarily recalled. And the reason for that is because in the what they're saying that there are dangerous concentration of nitrosamines in the pills.
So some pills are better before taking them to check, even on the internet, whether there were recent recalls or causing some problems.
So when they are recalling it,
There
it means that disaster already happened. Nobody's going to recall in advance.
That's true.
They recall when they cannot hide it.
Could you repeat again this name of this drug that they recall?
Valsartan, ibuprofen, also I think a lot of sartans.
And this is American?
No, not necessarily, not necessarily. But that's what it is. And the same thing is that with the supposedly with vaccines, there was the problem. Vaccine itself is not a problem. The problem is its conservant. It contains mercury. That's why some people.
Yeah, you also mentioned mercury. I remember our show was program was about mercury.
Yeah, well, that's not because of the vaccination itself. It's because of what they're doing. They use the conservant to preserve preservative, which contains mercury, and that's what happens. And the same thing happened to those pills.
I also remember you said don't eat large fish, eat smaller fish.
Yeah, that's the same thing. But once again, let me just tell you the story.
Yes,
it happened like maybe 10 years ago, and the guy came to me with high blood pressure, and I said that, you know what, why don't you lose your weight and stop eating sweets, just get potassium-rich foods, stop smoking, stop alcohol, stop alcohol. That's very important. Okay.
It also has something to do with high blood pressure.
Of course. And what happens is that the guy disappeared from my office. We tried to recall him, and when I got him on the phone, he said, "Doc, I don't need you. I lost my weight. My blood pressure is down. Why should I come to your office?"
Ah, so you're saying he followed your advice?
Yes, he did.
And disappeared.
Later on, he came back because he eventually stopped following the diet, and he thought that he can do anything he wants. So he got back, got another portion of treatment from me, and he disappeared again.
But did he stop alcohol, smoking, etc.?
Listen, there is no perfect person. It like comes and goes.
Okay.
You know, who...
For some period of time, okay.
And that's what happened. But you know, if the potassium issue, low potassium diet and high sodium diet and obesity is a problem, is probably very easy to treat. Mercury is a little bit more difficult because this patient needs chelation therapy. And usually in the real life, they are coming by all three together, or two of them, you know, because it doesn't come isolated. Usually patient, but that's what it is. It's not that difficult. You just need to be persistent. That's all.
So basically, you're saying that treatment from high blood pressure is easier than some other than to treat other issues, other problems. It's easier if you follow your advice.
It depends. It depends.
Eat proper food and
It depends. See, when blood pressure is already 160, it's kind of, you know, you lost your train.
Uh-huh.
And it happens, the reason is this, because what happens is that with the blood pressure, the vessels become too stiff. It doesn't matter what you do, because if they're stiff, blood pressure goes up no matter what. And you need years to reverse this process.
Also, is it more serious for seniors? That's what I've heard, than for younger people, this issue of high blood pressure.
That I can't answer this question because if blood pressure
Age, yeah.
comes high in a younger person, of course, in my understanding, I'm telling you, it's much more dangerous because this person has to live for a while, and if blood pressure is already high, it's kind of very sad, very sad. And mostly what we see is that the guys with the who are alcoholics and blood pressure goes up. That's very common reason for that. But other than that, well, of course, if somebody is in his middle age or a senior, then blood pressure, of course, is very dangerous because the vessels become very fragile. And what's the problem with high blood pressure? High blood pressure itself doesn't mean that much, but the complications like stroke, heart attack, etc., so the heart issues, that's what kills.
You also mentioned stress. So that if person under tremendous stress, it leads to high blood pressure. So
not necessarily. Stress, it's a very interesting thing because some people may perceive that they're under stress and in fact they just don't have enough adrenal hormone cortisol to cope with stress. It does not necessarily mean that they're under stress.
So it's not like someone coming to you, oh, like I have a tremendous stress at home, tremendous stress at work.
Usually,
so the solution is like vacation, take vacation.
Usually it's just the opposite. Because a normal person, if he's not working like 16 hours a day, should not complain with this. When we met first time, I was doing 2 jobs. Have you ever heard from me that I'm a tremendous understatement?
No.
Because I was doing 2 jobs without any problems.
Listen, you're in general, from what I see, calm person.
So that's because I have
You're
enough.
not like,
That's because I have enough cortisol to cope with stress. But don't you think that working as a hospitalist in the city hospital and running private office, it's a stressless job? No, I don't think so.
That's true.
And that's because I just had enough cortisol to cope with stress. And who has normally functioning endocrine system and sort of central nervous system, they should not have this problem at all, unless they have lack of sleep, they sleep like 4 or 5 hours a day, or they work like 16 hours a day. That's of course.
Also, another issue. It's women and men. They have similar, from your practice, who are more often inclined to have high blood pressure. Doesn't matter. It's only lifestyle and food?
It's a little bit tricky question. In my understanding, usually they believe that it's men. However,
Correct.
I may not disagree. I may not disagree, and the reason for that is this: because women tend to hide their problems, especially alcohol addiction. Blood pressure can go, and women sometimes become overweighted. It's very hard for me to say. I cannot answer this question, but I think the approach should be the same. No alcohol, because alcohol is a very well-known reason for blood pressure to go up. Alcohol, just simple alcohol.
Dr. Sergey Kalitenko, no alcohol, no salt, preferably no salt. And like, it
You
will
don't
help.
need it. Why do you need a food enhancer, the taste enhancer, if food is tasty as it is? You don't need that.
Okay.
So you still believe that a beautiful woman needs makeup?
Well, again.
Well, yeah, it depends.
Little bit.
Just
Why
a
not?
little bit,
Why
yeah.
not?
The same
Yes,
thing is
answer is
here.
yes.
The same thing is here. If somebody
Just do not go overboard with everything, Little bit salt sometimes in the blue moon, little bit alcohol sometimes in the blue moon.
Not table salt.
But not like,
Not table salt.
if someone
It's
is like
salt.
only salty food and drinks alcohol every day and smoke unstoppable and so on and so on, that's definitely
Yeah, just but
that recipe for all kinds of problems, not just high blood pressure.
processed foods. You know what? That's very interesting thing. I'm glad you started talking about that, because what they usually do, they brine food with salt to make it juicy. For example, if you buy chicken, rotisserie chicken from from the store, You know that they put salt in it?
It's already a little bit, yes.
It's not a little bit. It's brine and MSG is there, that's why it's so tasty.
And sometimes all of these fast food places, etc., they're using this so they want people to also order a lot of drinks, not alcoholic drinks, but like soda,
Coffee
water,
containing,
tea, because then you feel thirsty, you know, like so
Yeah.
they do it on purpose.
Of course, and what happens is they sell a lot of energy drinks, which blood pressure
Energy
too.
drinks, yeah.
There's very simple thing, a very interesting thing. They usually combine caffeine containing drinks with with this taurine. Why taurine is to calm a person down. You know, because if you give pure caffeine, the person can feel like uncomfortable. But they use a trick. Put taurine so you won't notice that you're getting too much caffeine.
Talking about soda, by the way, does it affect your blood pressure?
No, if it contains caffeine, that's what I'm trying to explain it, to tell you that all caffeine containing drinks, especially when they are combined with taurine, because in this case, the person does not feel that he is under caffeine influence. He feels great, but not too much, you know, and you have
What about coffee? America is addicted to coffee every day.
Well, I'm guilty too, so I have a cup of coffee once a week.
Once a week?
Once a week, yes.
That's nothing.
Once a week, a cup of coffee.
Many Americans, you know, drink coffee at the very least every morning, sometimes twice a day.
You know, many Americans smoke, many Americans...
That's all. By the way, it's going down. In general, in New York and all over the country, number of smokers is going down in the recent years. That's the statistics, you know.
No, that's statistics, you know, but unfortunately it's not that, because one thing goes away, another thing comes in. You know, because...
Opioid crisis you're talking about?
Everything, because according to statistics, as far as I know, in the United States, all over the country, it's about 20% who are using drugs that affect moods. Okay, so that's officially.
You're talking about
in the city.
antidepressants you're talking about?
This kind of drugs. And in Manhattan it goes up to 80. Unfortunately, not everybody agrees with this number, but some people believe that up to 80% in the city, in the Manhattan. Wow. We'll go and see. Okay.
I know about opioid crisis, but like 80% of...
Well, what do you think? You know, that's a lot of people they have to stimulate when they're involved in some kind of risky operations, or they're doing. Have you seen the movie? It's called Lion of Wall Street or something like that?
Yes, I did. Yes.
That's where just they show.
Yes. Wolf, not lion.
Wolf of the Wall Street. And that's
DiCaprio.
Yeah, DiCaprio. You remember how he talked about cocaine and everything?
Yes.
That's and how he was get used to it.
Yeah.
You remember that the broker brings him to the restaurant and shows how he snores cocaine.
Terrible.
Yeah.
Okay, but our patients will listen to Dr. Sergei Kalitenko, will lead to a healthy lifestyle, proper food, and will not rush to all kinds of pills without consulting with proper professional first.
Yeah. Okay. So if you don't have any questions, then we are going to finish.
Yes.
Okay. Thank you very much.
Thank you very
and
much.
see you next time.
See you.